Bob and Brad, the two most famous physical therapists on the internet.
Hi, folks. Brad Heineck, physical therapist.
Hi, I'm Chris the Pharmacist.
And I'm exactly one half of the Bob and Brad Physical Therapy channel. And Bob is not here today, but he's going to be back. We've got Chris here. He's done I don't know how much research on this topic with knee replacements and what you need to know if you've got a knee that's questionable and do you need it replaced or what are the options? It's all going to be answered right here. Before we go on any further, there is no giveaway.
No giveaway.
It's Saturday,
It's a
so
Saturday.
we can skip that. Absolutely
Sleeping in,
right. So,
checking out a little Bob and Brad.
Chris, I'm gonna let you take it away. I'm gonna give some advice on the exercises and stuff I know a lot about, and whenever I'm gonna chime in.
Yeah.
Carry on.
All right. Well, today we're talking about osteoarthritis of the knee.
Osteo. That's different than rheumatoid.
Yeah. Rheumatoid is more of an immune response. All right, and yeah, so we were talking about, with rheumatoid arthritis, that's the one that's your immune system is attacking the joint per se.
Sure.
This is the wear and tear that we all, at some point or another as we age, are going to develop.
Sure.
It's that wear and tear. It's kind of the tissues around the knee, specifically the cartilage starts to wear down. That's our shock absorber. And I don't know if we want to look at your buddy Sam or not.
Well, yeah, we can look at that right now. So, on the knee, the cartilage we're looking at, Sam, sorry about this, but we got to see this. Right on the bottom of the tibia, or the top of the tibia here, is where the two bones articulate, or that's where they rub together. And then these surfaces here, and these surfaces are nice and white and shiny when they're healthy. With arthritis, it's kind of like they're rusting. They start to develop pits, and they're not shiny anymore. And when the bones, the joints go together, instead of nice and smooth, it starts to grind, makes noises. We call that crepitus, and pain is almost always associated with it.
Yeah, and so that continually devolves really in bad cases of it. So it's something. So what do we do? That's kind of the big $1 million question. Are we all doomed to have knee replacement surgery? And the answer is no.
Right.
And that's the good thing. That's where you come in, where you're so adept at everything that you can do from an exercise and strengthening aspect. But, a lot of it comes down to what else can we do that are maybe non-drug related. So it's going to be weight loss.
Right.
If we get a BMI over, 30, there's a 7 times higher chance that you can develop knee osteoarthritis.
So like if you're 5'6" and you weigh 180 pounds, your joints are taking quite a bit more than if you were thinner.
Physics.
But a lot of people, including weight loss is very hard, very challenging. It may not happen to a lot of people for other reasons, and just because it's difficult for many reasons.
Correct. And so it's like, so what's next? Then it's strengthening that leg so that we can take care of that joint.
And actually, it's a therapist point of view. Before we get into some of the other options, if you do have arthritis in your knee, it hurts. It hurts when you walk. It feels better when you sit down. You need to check your range of motion. I'm not going to get into this in too much detail, but look at your range of motion. You need to have full extension. The knee needs to be fully straight. Compared to your sore knee, to hopefully your other knee is not so bad. If this one straightens out all the way and this one doesn't, it's very common with the painful knee. We have exercise or videos, nice videos that show how to stretch the knee, and this is one of the exercises. Simply stretch it gently, like I'm doing here. And you also want to look at the range of motion and make sure it flexes or bends all the way. Okay, and then when you get that full range of motion, you want to do exercises that keep the joint moving without weight bearing. In other words, a stationary bike. You can just put a towel on the floor and rub back and forth. There's the knee glide made specifically for that, particularly on carpet, or you can put it on an angle, which makes quite a difference when you have a sore knee. So those are a couple options. But if you Google Bob and Brad arthritic knee pain or arthritic knee exercises, we've got a number of videos that should come up, and you can look at those, and it'll go through those exercises in detail and get your knee feeling better or ranged out. And either way, before surgery, you definitely want to have that pre-op, they call that. But if you're just trying to maintain and avoid surgery, you still need to do that.
Yes, absolutely.
Go
And
ahead. I'm sorry,
Oh,
Chris.
no. I think that's important to interject all those things because at the end of the day, it's really about the joint and joint integrity and preservation. So, I
Sure.
mean, and you heard me say that, not everybody's going to end up with a knee replacement. I mean, we can do a lot of different things. We talked about, briefly controlling the weight if we can, if we, otherwise strengthening exercises, which I think is absolutely paramount and critical. But actually, how we eat and feed ourselves is actually pretty good. So
Sure.
there's a variety of different things. And actually, it'd be kind of cool to do a video with Jordan on this
Oh, sure.
osteoarthritis diet. But there's a lot of foods out there, and please, feel free to Google it. You can look at foods that help prevent inflammation and also nourish your cartilage. So we also used to think that cartilage, it couldn't regenerate itself, but that's really not true. It regenerates very slowly, like a glacial pace. So it's not going to be anything quick that can really just go ahead and I'm going to eat so well that my cartilage grows back to its normal spongy status. It doesn't really do that, but we can do things to slow it down or kind of regain some of that integrity of it.
So we probably don't want to get into details of a diet, but in general, is there some?
Yeah, it's going to be,
Rules?
it's going to be your, fish. So it's going to be like your salmon and your sardines because they're going to have the omegas in there. It's going to be your green leafy vegetables like kale and spinach and broccoli, those types of things. And so things like beets and blueberries, they all kind of work together synergistically. So you want to have a very complete diet.
Right.
And that helps to kind of give your body the things that it needs to protect itself to reduce inflammation. And when you eat kind of an anti-inflammatory diet, it helps to prolong and nourish those joints in all of our body, not just our knees, but we're talking about the knee today. So I think that's very important. And then
And if you eat that way, your joints are going to become more healthy, and you're probably going to lose some weight. It's
Exactly.
a win-win situation.
it is, and so it kind of, it's a self-fulfilling prophecy in a lot of ways. But still, there's times where, let's say you're a runner, you tweaked it when you were a kid playing football or tennis. It's just there's a lot of reasons why genetics withstanding male versus female, and I think that's an interesting thing too. Is that most osteoarthritis in the knee is 60% female.
Oh, really?
Yeah, so there's a
Because
high.
they work harder.
They definitely work harder and they're totally stronger. But at the end of the day, it's also a little bit of just how their bodies are designed with the
Sure.
hip angle. And I don't think we'll get too in depth in that
No,
because that'll put you to
'cause
sleep.
it is
But-
what it is, yeah.
But it's something that at least we see that with the statistic. And I mean, you're looking at 600,000 knee replacements a year, roughly.
Yep.
And so I mean, it's certainly. But there's a lot. That's only 600,000 people per year. I mean, there's a lot of people that are
That's
walking
just
around.
in the States, right?
Yes, that's a U.S.
Yeah.
Figure. So with that, so what do we do? Well, we move on. We do the physical therapy. We try pain relievers like ibuprofen and Tylenol or Aleve. Those things are.
And those are okay, I'm assuming,
they're
as long as
okay.
they work.
Yep, and they definitely help. But again, they begin to run out of gas. So then, now it's like, what do we do to try and preserve this, calm things down? So let's say you got a wedding you need to go to and you don't want to have knee replacement surgery and you want to prolong it, or maybe we can prolong it so that we get healthy so that we don't have to have the surgery. So those are options that are on the table. So there's two main things that doctors use as in their toolbox, and it's going to be your hyaluronic acid shots or your corticosteroid shots, or the steroid shots.
Okay, now I'm just going to say,
Yep.
you just said it in pharmaceutical terms.
Yep.
Let's say that what people
Yeah, so a lot of times I think
recognize.
doctors kind of talk about the Rooster shot or the Rooster comb shot.
Okay.
So brand name being like Synvisc, but there's about 5 or 6 other manufacturers out there that some actually use the Rooster comb, but other ones have found different ways to make the medication to minimize poultry allergies and things like that.
And those, I understand, actually try to regenerate the cartilage or add to it, or
and I think they aren't going to really regenerate it, but it's going to help to lubricate. So just if I had a can of WD-40 and I could spray it in your joint, that, and that's what these specifically call viscosupplementation. So we'll talk about the hyaluronic acid or Rooster shot first. That one, it's a mixed bag of nuts. All these shots are really designed for mild to modest osteoarthritis. So when it's severe, you can't do it. If you've got an infection, you can't do it.
Okay.
So there's limiting factors in these things. So I mean, when you are bone on bone, these shots won't do any good. So it's when you still got a little cartilage left, it's hanging on, or like I said, I mean, hyaluronic acid shots or Rooster shots can last up to 6 months.
Sure.
So, and it's a series depending upon the product your doctor chooses for you.
Right.
So there's a 1, a 3, and a 5-shot series. So it just kind of depends on the product that's utilized. They're covered by insurance, so which is good because they're about $1,200 a pop.
So Medicare in the United States,
Medicare in the United
will
States
cover
covers
that?
it, and I would
Okay.
imagine that over in Europe there's probably a similar type thing, but I'm
Okay.
not very well versed in that, so I don't
Sure.
want to throw words in anybody's healthcare system. But
So if that really is a conversation between you and your doctor, is because there's all these little variables, and
yeah.
you need to decide, is that it, or do you want to go more into that, or what the option is?
Well, I think we can. Well, I think we'll just to keep it with organized. So the hyaluronic acid or Rooster shots, they help once they find where they need to put it.
Okay.
And they'll do a very extensive workup for you and figure out what's going on. They're going to put it into the knee joint itself.
So they use a needle.
Yep, they use
put it
a
in
needle
there.
and they squirt her in. It's usually about 5 or 6 milliliters, which is just about a teaspoonful of liquid. So it's just a teeny tiny
Okay.
amount. So it's not much. A little bit goes a long way.
Mm-hmm.
And so they place that, and sometimes they use ultrasound to show where the needle needs to go.
Sure.
And place it. And sometimes that knee can be pretty swollen. So sometimes they might pull a little bit of fluid out to make room and put that in. It also is twofold. It also pulling some of that pressure off actually allows that knee to feel a lot better too.
So they pull fluid out, your bodily fluid out,
Yep.
because it's all swollen.
Yeah, it's effusion and swelling.
Gives
so
you room to put in the medicine.
put in the medicine. So that's actually an important step. So it's just something, then you're mentally aware that you know these steps may be coming. Not everybody has that happen. Sometimes it's not quite that inflamed, so it's not necessary.
Sure.
Again, your doctor, very well versed. They are so strong in these areas.
Yeah,
So
I agree.
again, it's above my pay grade. But but the reality of it is, it's just something that you will have to probably be prepared for, at least mentally.
Right.
But when they inject that in there, depending upon the product that they use, whether it's the 1 shot, the 3, or the 5, if you're coming back, it's every week for 3 weeks, every week for 5 weeks, or the one-time shot. So your doctor again will determine which one of those is most appropriate for
Sure.
you, allergies and withstanding. And so they're going to place that in there, and you have to have rest for 2 days after this shot.
Okay.
You can't just go out. I got my shot. I'm all lubed up. I'm ready to run a marathon. It's not happening. So it's actually very important to listen to your doctor's advice with the healing process to make sure that that sets properly, helps to bathe and nourish the existing cartilage that's left,
Sure.
and help to create that good lubrication like we saw like in the knee joint itself.
Right.
And so, and it can last. And actually, the unique thing about the hyaluronic acid or Rooster shots are the pain relief is in many cases more durable or longer lasting than what you get from the steroid, which is the next drug we're going to talk about.
Right. I just wanted to mention, because I had my mother in.
Yep.
Knee, she's her weight is not healthy.
Yep.
She's got other issues. Surgery's not an option for her, and they talked about this shot, and then they talked about the steroid.
Yep.
And after a little discussion, and my mom wanted me there because the therapist still knew what to
Yes.
do, so it was my decision, not hers.
Yep.
In her mind, but it was pretty easy in her case. We decided the next
to
option,
come out.
the,
Yep,
the
and so-
steroid.
Yeah, the steroid shot, it's a corticosteroid. So, and the reason that those are in many cases favored over the hyaluronic acid shots are it provides more immediate pain relief early on. The hyaluronic acid shots take a little time to develop, so their wheelhouse
So
may
you're talking
be-
about weeks?
Yeah, like about 4 weeks, and then can last up to 6 months.
Sure.
So it just kind of depends. So again, it's bathing and nourishing the joint, but for a lot of patients, and a lot of the research suggests it's inconclusive or inconsistent relief. So it's not everybody, it's not for everybody, and it's not for every circumstance. And your doctor will recognize that very clearly and give you the options like they did like with your mom.
Yeah.
So the next option that we talk about is the steroid shot or the glucocorticosteroid shot. And that's the one that helps to reduce inflammation. And by reducing inflammation and swelling in there, it calms that down to allow hopefully our body's natural healing processes to kind of take place.
Sure.
But we have to be careful when we're doing a steroid shot in any joint, but we're talking about the knee today, because too many of them can actually degrade the tissue, the bone, the cartilage, and even the tendons.
Sure.
So the example that we always see in a lot of cases, at least with the tendons, are we've seen a dry rubber band. So you know how stretchy, and elasticy a nice rubber band
Right.
is. You can pull it and you're going to get it. But, too bad we don't have a.
I thought I had one back.
But-
well, it'd be like this.
Yeah, so you can kind of see that that's nerve tissue, but if it were your cartilage, it kind of behaves the same way, or if it's a tendon, it behaves the same way. But when we use too many of these steroid shots, and the magic number is 4.
Okay.
You don't want to go any more than 4 in a year, so you keep 3 to 4 months in between those shots
Okay.
to help to allow the drug to metabolize out and make sure it doesn't make it brittle.
So it's
'cause
like an old rubber band in
old
the
rubber
sun,
band and it just pulls apart.
and it breaks.
Yep,
Yeah.
and it may actually decrease the ability for the body to regenerate its own cartilage and or even degenerate in the bone itself.
Sure.
So, questions your doctor will screen you for, making sure there's no infection, making sure there's no allergies to certain components. It's kind of funny to be allergic. There are some people that are allergic to steroids, which is a strange irony because people get steroids to treat allergies in a lot of cases.
Sure.
But there are small circumstances. So again, you would be acutely aware of that because you would have experienced something quite negative. So your doctor will screen you to make sure it's appropriate. And moving forward, we're going to say you are. They're going to place it again very carefully and put it, and they'll use maybe a little bit, might pull some fluid out, and then they're going to put it into your joint.
Sure.
And a lot of times they mix it with a pain reliever called lidocaine. And it helps to numb it. So a lot of times patients experience almost immediate relief, and that's a little bit of a slippery slope because all of a sudden, wow, my knee feels really good, doc. I'm going to go mow the lawn, or whatever. And again, the answer to that is no. You want to take a couple of days off to allow that shot to take place and let some healing begin, and then you can begin to strengthen, exercise, enjoy.
Right.
So we have to be real careful with that too. The side effects with both the hyaluronic acid shots, or the Rooster shots, and the steroid shots are almost similar. So sometimes, you want to report to your doctor if you get a little bit of irritation, get some redness. Sometimes with the steroid shot, you can get some blanching of the skin if it's placed closer to the surface. So some little tweaky things that people notice from time to time, but generally very safe, very effective choices to try and help to reduce that inflammation, improve pain, and hopefully stave off or even maybe not have surgery. I mean, your mom responded unbelievably well.
She did.
to
She
that
went
new
in.
shot.
The doctor was very good, explained it to me and to my mother so we both could understand it. She got the shot right. I mean, it wasn't even scheduled. We were just there for knee pain.
Yep.
And I thought he's going to say, come back next week and we'll give the injection. He did it right there.
Yep.
It was almost pain-free for her.
Yeah.
I thought it was one of those things where you kind of, bite the bullet
yeah.
while they inject, but it wasn't.
These guys and gals are so skilled
Yeah.
that they are so good at what they do, and they just understand anatomy and physiology so great
Yep.
that they really can't. I mean, they're there to help heal. I mean,
Yep.
that's their job, and I think that they utilize the tools in the shed to maximize it. I mean, sometimes the inevitable is going to happen where the damage just is too great,
Yep.
and we have to have the replacement. But there's a lot of people like your mom that are in that quasi state, and the other thing that we have to look at is whether we use the hyaluronic acid shot or the steroid shot, healing can begin. So
Sure.
if we're working on that strengthening, we can prolong or maybe even avoid that surgical result. So I think that's really critical to take home.
In her case, it was last fall. She got the shot. Within a week, she was feeling better, and she hasn't mentioned knee pain since.
Yeah.
So it's
proof's in the pudding.
Yeah, it's. I'm very happy with that, and so good. Were we going to cover something else with this?
I don't know that we were.
Well, no.
I mean, we could talk about like platelet enrichment. Or do you want,
is that an option?
it's an option, but it's a
So
little bit
we're-
on the fringes.
So we're talking about it's PRP.
Yep.
Yeah.
So I didn't know we wanted to include. I mean, we can. So basically, what they do is
Well,
they,
people are tuning out anyways. They got what they wanted, but if they want to see that, because I just got introduced to that with my shoulder
Yep.
issue, and I watched a continuing ed last night about it
Yep.
for hip issues. So it's
Yeah.
like, oh, this is new, but it's out there.
It's new, it's out there. The research is kind of all over the map. There's not a lot of consistent ways that doctors have been doing it. So I think if they can find a more consistent way to deliver it, I think it's got promise. Because what they do, they centrifuge it out, they oxygenate the blood, they put the
So they
platelets back
actually
in.
take your own blood out.
You're using your parts.
Right.
Yes. And that's what's nice because you're not going to be allergic to yourself.
Sure.